Hi, my name is Martin Melby. I'm a physical therapist working with treatment and rehabilitation of people suffering from spinal conditions. Why did I develop a herniated disc? That's a question a lot of my patients ask me. Behind that question lies the understanding that the disc herniation is caused by the patient did something stupid to their backs. And now they want me to tell them what they should avoid in the future so it doesn't happen again. However, the cause of a herniated disc is rarely caused by something the patient did. If you want to know more about causes of a herniated disc, stay tuned for the next couple of minutes. On my right hand side, I made a drawing of a young disc. A young disc is made up of an outer ring built by strong fibers. In the middle, the disc contains a softer material with a high water content. This construction makes the disc a great shock absorber, sitting between the bones of the spine. Lab experiments have proven it a young disc almost impossible to break on purpose. Disc herniations occur when this soft, mobile material in the middle slips out of the disc through clefts and tears in the outer ring. The disc herniation can then compress nerve fibers sitting outside the disc. However, a young disc does not have a lot of clefts and tears, so disc herniations are rarely seen in young people. In the other end of life, we have an old disc here, drawn on my left-hand side. In terms of spinal aging, old refers to someone at the age of 55 years or older. The old disc will have lots of clefts and tears, but the central part is no longer soft and mobile. So it's very difficult for the central material to slip out and compress the nerves. The majority of disc herniation is seen in middle-aged people, meaning someone aged 30 to 55 years of age. In this middle-aged disc, we will have started to develop clefts and tears, and the central part is still relatively soft and mobile, enabling it to slip out through the clefts, compressing the nerves. In other words, the main reason that you may have developed a herniated disc is caused by the fact that your spine has now become middle-aged. Two other major factors in terms of risk is genetics and heavy lifting. Genetics being the biggest risk factor. Should one of your parents or siblings have had a pain caused by a herniated disc, your risk of developing a disc herniation is up to 6 times higher. Really heavy lifting, meaning 10 kilograms or heavier, lifted in an awkward position with your spine bent, increases the risk by 1.5 times. In other words, it plays a larger role who gave birth to you than what kind of loading you exert on your spine. If you want to reduce the risk of developing a disc herniation, you should get some physical exercise or physical activity. Actually, any activity that makes you sweat and lose your breath will reduce the risk of developing a disc herniation. We think that physical activity and exercise helps the body repair clefts and tears in the annular wall because it stimulates the blood supply in the spine. So the understanding today is that regular physical activity and exercise assist the repair of these clefts before they become large enough for soft material to escape and cause you pain. If you need more advice about physical activity, exercises, you'll find it on my website. Thanks for watching.